This is the SNAP video for our patient. The client is a 2.5-year-old diagnosed with spinal cerebellar ataxia type 29. Child's main mode of mobility is using a posterior walker, but is practicing with lobster and crutches. He is not efficient with the lobster and crutches at all, so his main form is the posterior walker. He has ataxia, troubles with motor planning, and overall difficulties with mobility. And the patient is able to communicate verbally and understands cueing.
To narrow down the problem areas, the top 4 or 5, it's his fine motor movements. They're slower, and he has difficulties planning what he wants to do. He knows he wants to like throw a ball or something, but it's just a little bit slower, and he hesitates before he does that action. He does mainly use his right hand to play or do any activities. We were moving rings from cone to cone, and he would only use his right hand. We would ask him to use his left, and he would be able to. And then after you didn't tell him to use that hand, he would go back to his right. He is unable to stand unassisted, so then he uses that posterior walker or crutches. He does have orthotics. He can stand just for a little bit unsupported, but he's going to fall right away, either forward, backwards, and he probably won't be able to catch himself as good as a normal or a typical child. He does have that typical motor planning with anything, walking, going upstairs, anything like that. And then his mom was pointing out his poor core control and strength. When he's playing, he uses his left hand to put back somewhere to lean on for that balance, and then he's able to do things. His mom was saying that if he's playing with his sister and his brother at home, he'll have his back up against like a couch or something to gain that stability and then do his activities.
So the single main problem area is difficulty with his mobility due to the ataxia. The ataxia also causes deficits with the sitting and standing, as Doug mentioned. This was reported as the main issue from the mother, as well as the main intervention that the physical therapists and occupational therapists have been working with him thus far. Some of the questions that we will ask Kathy, our instructor, is how do you manage if the patient has difficulty with following tasks when you direct them to do something or transitions? What are some tips that we can use to maintain a proper flow? Another uncertainty we have is when the patient will progress out of the posterior walker to lobster and crutches. Like, is there a timeline that we should be aiming for with this, and how we can reach those goals when we want to?
All right, so for our intervention, we are going to be practicing kind of moving objects across midline, especially with that left hand, because he likes to, he favors the right hand with everything and use the left hand mainly for balance. And then he's able to, then we're just going to work on like standing independently. We can do different kneeling positions, different sitting. We can do like sit to stands, do like stabilize his ankles, give him some support and stability. He's able to like squat down and play. So I'll use that. We can practice going up and down stairs. And we'll practice kind of with his posterior walker and lobster and crutches, kind of like anything movement. We can easily just go and practice with all that stuff, because during our main examination, we just kind of watch them play, so we can just easily incorporate that towards the intervention. And we're just working on mobility. And so some issues and topics for self-study is we just kind of want to research a little bit more about spinal cerebellar ataxia and just kind of how they can differ in terms of prognosis and progression, just kind of understanding the diagnosis a little bit more, and maybe kind of looking into different interventions for children with ataxia and things like that.